Medical Diagnosis Artificial Intelligence Project. This the problem description of this project, or the problem we are trying to tackle through this project, is misdiagnosis. At times, patients are misdiagnosed. There was an example, one which is quite popular, a case where Ted Blackwell, who was misdiagnosed by doctors from a Kaiser clinic in California, was diagnosed with headache, yet it was cerebral bleeding he was actually suffering from. After being misdiagnosed, he went home like around 4 days, and it only kept worsening, and was taken to a different hospital where he was finally confirmed to be having cerebral bleeding. He would have actually lost his life just because of being diagnosed with a wrong disease. About 12 million adults are misdiagnosed every year. These are facts. 10 to 20% are patients with serious conditions. Imagine that a patient with a very serious condition like cancer is misdiagnosed to have a smaller illness. This could really lead to worsening of that disease and almost death. 44% of some types of cancer are misdiagnosed. 51% of breast imaging second opinions result in a big change of interpretation. The background of this artificial intelligence project and actually its accountability. The Medical Diagnosis Artificial Intelligence Project has a strong background, which dates back to the middle 1900s, but it was less practical as it was solely based on determining sicknesses from signs and symptoms. Later, in the early 2000s, when deep learning was discovered, artificial intelligence in medical diagnosis became more advanced as deep learning helped a lot more. Artificial intelligence accountability means looking solid evidence of governance at the organization level, including clear goals and objectives for the AI system. The significance of this artificial intelligence project is quite big. It simplifies diagnosis of patients as it has a standard accuracy of 72.52%. It's even more accurate than a normal doctor, whose accuracy is estimated to be about 71.40%, according to a study. Artificial intelligence techniques like deep learning and machine learning help in diagnosing, discovery of drugs, and risk identification in patients. Artificial intelligence can even be used to perform complex surgical operations. This is through the use of robots. The scope of this project. Medical diagnosis is an area that is very important in healthcare, yet very risky if not properly handled. Misdiagnosis at worst can lead to loss of life. But with artificial intelligence, misdiagnosis can be solved as AI provides a high accuracy value. Though it's not yet highly feasible due to lack of sufficient technology to implement the project. But of recent, many milestones have been overcome and implementation of the project becomes more possible. A problem statement. Misdiagnosis of patients is a problem so big that it can even lead to death of the victim. About 28% of cancer cases are misdiagnosed. And the longer it takes to diagnose a cancer, the less the survival chances. How bad? That's why we really need to fight misdiagnosis. It could lead to loss of many more lives that we can actually save. So what's the main question we are tackling here? How can misdiagnosis and its impacts like death and mistreatment be overcome in the health sector? The hypothesis. Misdiagnosis can be solved using artificial intelligence. This is through using it in the diagnosis process. Artificial intelligence can be used to determine illnesses more accurately compared to humans. These, of course, are the doctors, the nurses, and all the physicians involved. The objective of this research question. The objective of the research is to solve the problem of misdiagnosis in the healthcare sector, or at least reduce it. This research, if successful, can save millions of lives in the future. It can improve medical diagnosis in the health sector, understand in detail the causes of misdiagnosis. The dataset description for the dataset being used. Dataset, first of all, is a group of ordered data. Dataset is accurate, it's relevant, and it's reliable. The dataset contains signs and symptoms of prostate cancer. The dataset contains examples of patients that suffered from prostate cancer. It contains a report on the various cases of prostate cancer patients. It contains treatment details of the patients. It also contains a birth prostate specimen. The artificial intelligence methodology is the inference, diagnosis of prostate cancer. And these are the steps it has got. And there are quite many references that could help study more about medical diagnosis using artificial intelligence. There are quite many. Some can be got online, whereas others are books. For example, one by Emerio, Artificial Intelligence in Healthcare, a complete guide, 2021 edition. And then there is another book dated September 2022, it's by Kavita Behera, and a few others. It's Artificial Intelligence in Medical Diagnostics. Come to the end of our presentation.